chair of this meeting, together with Councillor Ruth Dombey, who's sitting right next to me here, and will be from the next time onwards. Before I hand over to Ruth, I wanted to just say a few words. First of all, to remind you that we are recording and live streaming this meeting. I think I'm right in saying, so just to make you aware of that. And the other thing to say is thank you very much for your time. Thank you very much for putting your hand up and wanting to be part of this very important part of the governance structure in South West London. So before I do some housekeeping, let me hand you over to Ruth, who will want to say a few words, I'm sure. Ruth.
Thanks, Millie, and hello, everyone. It's good to see so many people on this call, and I'm looking forward to meeting you all in person. I hope you're all as excited as I am about the possibilities that we have, opportunities going forward. We've seen the impact of health inequalities on the 1.5 million people living in our 6 boroughs. We've seen them for many years, but COVID, I think, has really brought to the fore just how unequal our society is and how much we need to address in practical and meaningful ways those terrible health inequalities that sadly are part of the world that we live in. I think we have a real opportunity here to bring together the NHS, local government, the voluntary and community sector, Health Watch, and everyone involved in this world, and think about how we can break down some of those silos, stop thinking from the point of view of our own organisations, but start thinking about outcomes for people living in our area, how we can make a meaningful difference, how we can give people real opportunities, and how we can shift some of the funding towards prevention and early intervention that will ensure that people have the opportunity to make choices, decisions, understand the opportunities that are available to them, and hopefully are able to make decisions about their lives that will have an impact on both their mental and physical health that could make such a difference. I really think this is a real opportunity. I recognise it's not going to be straightforward. We all have our different levels of accountability, and we all know that money isn't all in the same place. But I feel there's a real sense, there's a will and a determination, a sense of purpose amongst this group of people. And I think if we are willing to put in the effort, this could make a real difference. So I am very excited about the future, and I look forward to working with you all. Thanks, Millie.
Ruth, thank you for those inspirational words. I think we would do well to bear those in mind as our guiding principle. So thank you very much, Ruth. So back to the housekeeping. You have dates. You should have dates in your diary for the next meeting of the partnership. That's in October, on the 5th of October, 5:30 to 7:30 at the Hotel Antoinette in Wimbledon. This is our first meeting, so any ideas and feedback you have about how this meeting could be even more effective than we can try and make it today, please feedback to us, because that's been really important. We have to learn a little bit as we move along. As Ruth has said, this is an unusual get together, but a very exciting one nonetheless. So just to remind you that the presentations you will see, the presenters have been asked to assume that we've all read the papers, which I'm sure you have done, and they will be taking questions from us and any challenges that you have. So feel free to go through them as we go through the agenda. There may be questions from the public, and let me take a moment to welcome members of the public now. Thank you very much for joining us. We're really very pleased to have you with us today. And we will answer the questions that have already been lodged by email from the public at the end, and any other questions that anybody else wants to raise also at the end. Just to emphasize what Ruth has already said, we're not here to represent our day job, as it were, or your organizations. We're actually here to work together for the patients and the citizens who live in South West London. So that's the sort of principle on which we will operate. After the meeting today, the first part of the meeting today, we have organized a development session, and that's really to get us into the mood of working together and starting to put some flesh on the plans that we want to move forward with. So that's going to be from 3 o'clock onwards. No, 1 o'clock onwards, I think. I'm getting confused about the timing. Okay, before we get into the meeting, let me ask you, please, if you would very briefly introduce yourselves. So I'm just simply going to call out the names I can see. And then I think you'll have to take it as it comes because, as I say, I can't quite get everybody on my screen. So people I can see, I'm going to call out. So John Byrne.
Good afternoon, Chair. Good afternoon, Ruth. John Byrne, Chief Medical Officer of the ICB.
Anna.
Hello, colleagues. I'm Anna Popovici, Director of Children's Services for Wandsworth.
Piers.
Hello, I'm Councillor Piers Allen. So I'm the Health and Wellbeing Board Chair at Richmond and also the Community Replace for Richmond Partnership.
Catherine.
Good afternoon, everyone. I'm Catherine Williamson, Director of Richmond CVS, and I'm the Interim Voluntary Sector Representative.
Carol.
Good afternoon, everyone. I'm Carol Cole and I'm Vice Chair of Central London Community NHS Trust.
Shannon.
Good afternoon. I'm Shannon Couture, the Director of Public Health for Richmond and Wandsworth, here as the Place Committee representative for Wandsworth.
Gillian.
Hello, I'm Gillian Norton. I chair St George's University Hospital and Epsom St Helier.
Anne.
Hello, everyone. I'm Anne Beasley. I'm Chair of South West London and St George's Mental Health Trust. I'm also on the boards of St George's and Epsom and St Helier.
All right. I can't see anyone else now on my screen. I think Yvette is on. Yvette.
Oh, hello, good afternoon. I'm Yvette Hockley. I am the Chair of the Health and Wellbeing Board in Croydon.
Okay, well, thank you very much. Anybody else that I have?
Millie,
Yeah.
can I help? So Graham is there.
Okay, Graham.
Hi, good afternoon. Councillor Graham Henderson. I'm the Chair of the Health and Wellbeing Board in Wandsworth. I'm also the Cabinet Member for Adult Care and Health. Thank you.
Thank you. And Saba?
Hi, my name is Saba. I'm a councillor for Kingston Gate, but also portfolio holder for adult social care and public health.
And Sukhvinder?
Hi, yes, sorry if you can't see me, Millie and others. I'm Sukhvinder and I'm Chair in Common at Kingston Hospital and also at Hounslow and Richmond Community Health Trust.
Now I've run out of people. I can see.
So there's Millie, there's Peter and also Carolyn.
Yes, Peter. Peter McCabe. Peter.
Hello, can you hear me?
Yes.
I'm Councillor Peter McCabe. I am the Cabinet Member for Health and Social Care and Chair of the Health and Wellbeing Board for Merton.
Thank you. And Sarah? Who else did you call out?
Sorry, and I'm sure Sarah and Karen want to come in too, but there's Carolyn as well on the call.
Okay, Carolyn.
Hello, everyone. I'm Carolyn Dwyer. I'm the Strategic Director for Development, Growth and Regeneration at Sutton.
Yes, thank you. And Sarah?
Sarah Blow, Chief Executive of South West London ICS.
Karen?
I'm Karen Broughton. I'm Deputy Chief Exec and I'm Director of Transformation People.
Charlotte?
Charlotte Gorn, Executive Director of Comms and Engagement for South West London ICS.
Gloria?
Good afternoon, all. My name is Gloria Rowland and I'm the Chief Nurse for the ICB.
Now, who else hasn't said who they are? Okay. And can I just mention, Neil McDowell?
Hi all. Yes, so Neil McDowell, I'm Deputy CFO for South West London ICB, but I'm here to cover for Helen Jameson, who will be obviously the exec CFO at future meetings.
Thank you very much. And we've got our support team here, which is Gurvinder, who's going to help with the minutes, and Price, also working on the minutes, and Jay, who is also helping us in the background. And we've got Andrew Demetrius, who's done a lot of the preparatory work. And who else is on here that I haven't called out? Anybody else?
Liz Mirabeau, of course, masquerading as Ray, as
as you'll know, Millie, the perils of having a domestic Teams account that refuses to let the names be changed on it. So I'm happy to be here representing the 6 health watches, which I will be doing until we've got the paid post.
Thanks, Liz. Yeah, thanks, Liz, for explaining that. Okay, I think we've covered everybody. Have we covered everybody? Anybody not mentioned? Last chance.
Oh, I'm here as well, Rebecca. I'm here to facilitate the next session,
Rebecca,
but I'm just listening
Rebecca, I was
in.
just going to mention you. So we also have Rebecca Eligon, who is from the organization called Collaborate. Rebecca is observing this part of the meeting, and then she will be facilitating the next part of the meeting. So welcome, Rebecca. I do have some apologies. Anne Beasley, Mike Bell, Nicola Jones, Charles Alexandra, Dino Patanani, and Joe Farah unfortunately cannot be here. So on that basis, let's get started. So I'm going to hand over to Ruth. Ruth.
Thanks, Millie. And as you can see, even virtually, our co-partnership is seamless and is working really well. We have to go through some technical bits and pieces, which is the right and proper thing to do. So I'm just going to mention the register of interests, and I've been told to be very polite and very gentle, as I mentioned that a few of you, I'm afraid, still haven't replied to the email and filled in your register of interests. Can I ask you to do that urgently, please? It's really important that we do things properly and with transparency. So it's only a small minority of people on the board, but could you please ensure that you fill in your register of interests very, very quickly so that everything is on board? And in the meantime, can I ask that everyone who has already filled in their register of interests, do you have anything to declare that's not on that register? Do you need to declare any interest arising from the agenda or papers presented for the meeting today? If you could just indicate either in the chat or by raising your hand, that would be helpful. Thank you.
Okay, no hands are raised, Ruth, so we will move on. Thank you very much for that. So let's get into the substance of the meeting now. So the first item that we wanted to talk you through was the draft terms of reference. Karen is going to take us through that, but just as a starter, let me tell you that Ruth and I and the executive team have worked together to put the terms of reference together for you, but they are still in draft. It's for this meeting to review them and to approve them today. So on that basis, I'm going to hand over to Karen Bratton. Karen.
Thank you, Millie. So in front of you, we, as Millie said, we've developed these in partnership. There was a number of national documents that were presented regarding the integrated care partnership, and we've tried to bring together the salient points out of all of those to create a terms of reference by which we all then operate through. And just to kind of pull out some main points to it. So the Integrated Care Partnership, or the ICP, is being established as a system level by the NHS and local government as equal partners, and it's a statutory committee of the South West London Integrated Care System. So one of the most important governance vehicles that we'll have as a system. It will be made up, and you'll see through the terms of reference the membership, but just to explain that, members of the Integrated Care Board or members of the Integrated Care Partnership, our local authority representatives are here. We have our providers represented through chairs. We have the voluntary sector Health Watch, and we have a range of people fulfilling specific roles. The terms of reference also mentions that there will be times, given the agendas that the ICP will put together, where we will bring people in and ask them to be present for either specific meetings or specific items to help the breadth of the conversation. A really important part of the partnership is its focus on improving health and well-being of the population to reduce the health inequalities that we currently see across South West London, improve care and health and well-being of the people of South West London. A specific responsibility that the ICP will have is the development of an integrated care strategy that will be pulled together this year, looking at the health of the whole of the population to make sure that we improve health and care outcomes for people within South West London, and that we make a real difference to the environments that people live in, the health outcomes that people have, and the inequalities that exist. And we'll do that by looking at the whole range of things that impact someone's health, including their environment, etc. The ICP we identify will champion inclusion and transparency and will be focused on really demonstrating progress and impacts that we'll collectively work together to have, so that people within South West London receive much better health and care, that we prevent ill health as much as we can, and that we reduce health inequalities, as I've said. But really importantly, that we engage our communities and the people in South West London as we do that, to make sure that we are meeting the needs of the communities that we serve. So the national guidance also identified a range of people that should be part of the ICP. You'll see that's on the cover sheet at the beginning. We've gone further and made it a much more inclusive partnership. And we developed that through a whole range of conversations with members across South West London over the last few months. So wasn't planning to go through anything in huge detail. We do also mention in here some of the committees that we are currently thinking that we may well create, but we need to do some more work around terms of reference for those, and also the responsibilities that they'll have. And I suppose we will finalise those when we are clear about the health inequalities strategies that we'll put in place, and also the priorities that we'll have. And I think those committees therefore may move, and working groups, etc., be created to make sure that we've got real delivery going through South West London, to make sure that the ICP work is then taken forward in the way that we want it to be. So I am recommending the terms of reference to members of the partnership. And I'll ask them to review the draft that we have. As Millie said, they are very much in draft, and approve that, so that we can then finalise those and move on. Thank you, Millie.
Thank you very much, Karen. So comments on what you've seen so far? Catherine?
Thank you, and thanks for that, Karen. Just got a couple of points, bearing in mind what we've already heard about what we want to achieve through the ICP. My view would be that in the terms of reference, it could be a little stronger on reference to the voluntary and community sector, or VCSE, as NHS England often refer to it. It's not actually specifically mentioned. It talks about independent providers and community partners. I think putting that wording in would be quite powerful. So that would be one thing. And secondly, and very importantly, I feel that the role of the voices of service users and carers is not really referenced. We talk about championing inclusion and transparency, which is all good, but I think more emphasis on service users and carers and the co-production approach that we want to have. I think it would be helpful to bring that out more, to ensure that we are not doing things to people, but we are working with them to improve their health and well-being. Thank you.
Thank you, Catherine. Those are very excellent points. So as you can see, people are nodding all over the place. So we'll take it away and incorporate those ideas. So several hands were up. Anne Beasley.
Thank you, Anne. And just to confirm that I am here, I wasn't going to come. So I did send my apologies, and then I reprioritised. So
thank you, Anne.
Decided I would come. Karen, thank you. There's no reference to any sort of resourcing committee, and so I was thinking about if we were going to come up with trying to prioritise and how we would invest. So it would be helpful to know a little bit more about your thinking on that.
So I'm going to take the questions and then ask Karen to wrap up the answer, or anybody else that wants to comment. So Carol?
Thank you, Millie. The terms of reference are really helpful. They're really clear. There were 3 areas that struck me that might merit further consideration. One is around risks, given that the primary kind of responsibility of the ICP is to have responsibility for the development of an integrated care strategy. I wonder whether it's worth making more prominent our responsibility to identify, possibly escalate risks to the achievement of that strategy. So that was the first one. Karen, shall I just go on to the other 2? The second was around self-review. So in a spirit of continuous improvement, and we see later on, quite rightly from Gloria, a reference to quality improvement, I wonder whether we should, as a group, perhaps informally but more formally, review our own performance on an annual basis. In other words, are we, as an ICP, how are we doing? Are we delivering against our terms of reference? Are we operating as efficiently and as effectively as we might wish? So maybe something around self-review would be helpful. And then finally, something that I've seen in other boards I'm familiar with, and that's to be able to obtain external legal or other professional advice on any matter within our remit. It very rarely needs to be exercised, but it's hugely helpful to have anticipated it and put it in case something emerges where one or more of us feel we would welcome and benefit from external opinion. That's all, Karen. I'll pause there. Thank you.
Thank you, Carol. And Councillor Hopley, Yvette?
Thank you. It's just a procedural thing, really. I should have said, as well as being the chair of the Health and Wellbeing Board, I am the cabinet member for Health and Adult Social Care, and I have a deputy. And I wondered if I wasn't able to attend a meeting, whether the deputy Health and Wellbeing Board chair, and also she's the deputy for Adult Social Care and Health, whether she would be able to attend and whether or not she would have a vote.
Thank you. Karen, would you like to address as many of those comments as you can, and then we'll need to decide how we move this forward. Sorry, Karen. Any other questions? Anybody else that I haven't called? There's still one hand up.
Millie, it's me, Sukhvinder. My comment is just about the responsibilities that are set out. So on page 11, under the first responsibility, it says develop the South West London integrated care strategy for the South West London population. I just wondered if we should be looking at any sort of sense of timeline against these activities to ensure that we have some pace and productivity to the conversations that are taking place.
Thank you very much. So Karen, could you comment on all of those, and then we can decide how we move forward? Thank you.
Yes, certainly. I think in relation to your point around resourcing, Anne, I think one of the things that we need to think about is what is the funding that we would want to jointly put together into the ICP. It's one of probably the important conversations that we're going to have. And therefore, when we have that, what's the right place in which to make sure that we govern that well. So as I said at the beginning, I think we've had some initial thoughts around some of the committees. I do think we're probably going to have to review those as we know the work and what's needed more from the ICP, because it's fine when you're looking at things, but actually as we develop further, we'll get greater clarity. So I think that's probably one of the things that we probably want to come back to. In relation to Carol's part, I mean, risks, I think we could put that on the agenda, Carol, couldn't we, in terms of our, when we decide our work plan, then obviously then we can think about the risks to that. Whether we need them in the terms of reference, we can put them in if that's helpful, but I think probably more importantly that we consider the risk to delivery as we move forward, and whether we build that into the agenda so that we're constantly keeping that in our minds, I think is helpful. I really like the idea of the self-review. We've got at the end of the terms of reference that we'd review annually. I think what you're suggesting is a wider kind of review of that, which I think is a good thing. One of the other things that we could do as an ICP is to review at the end of every meeting whether the work that we did today achieved some of the goals and took us further forward. So again, as we do our development programme as a board, because it's only days, isn't it, we can probably think about how do we best build that review in, and whether it's an annual review or whether it's more frequent, I think is probably something that we want to discuss together. I think external advice, yes. I mean, one of the things that we've said in terms of, and we can put that in the terms of reference, one of the things that we have said is that depending on the nature of the conversation, we will need to bring in different expert opinions on a range of different things. Sometimes that will be coming to the board. Sometimes that will be making sure that those considerations have been taken if we're doing board papers or if we're taking particular work through, but we could certainly strengthen that. I think one of the conversations that we collectively need to have is around deputies. So we haven't put that in the terms of reference, but really interested in people's views around whether deputies are acceptable and the work that might be needed to get those deputies up to speed, I think is probably something we need to think about, and whether they have the ability to make decisions on that person's behalf. So kind of a consensus view on that would be helpful, and then we can obviously then write that in. And then in terms of a delivery plan, I think one of the things that we would like to do, so just in terms of that, Sukhvinder, issue around, speed and making sure that we don't just talk and we actually deliver, I think is a really valid one. I think we could put together a delivery plan. Certainly the strategy development is written down nationally, so we'll have to deliver that in itself this year. But I think we should try and create a delivery plan of the work that we want to do, and then at each meeting we can consider that, couldn't we? But you're absolutely right. What we want to do is to make a difference to the people's lives in South West London, and therefore making sure that we've got momentum and that we're clear about the delivery of that, I think, is important. But I think again, a delivery plan would probably give us visibility on that. I think
there was another one about specific mention of voluntary sector and
yes,
patient voice.
definitely. I think Catherine's points were really well made, and we'll make sure that we put those in.
Okay. Well, thank you very much for all those comments. I suggest that we do that. Karen takes it away, and if we can work offline, if you agree, then we'll circulate revised terms of reference. And there will be some open-ended things, as she's mentioned, because they will develop as part of the program of work, and we'll come back to it when we meet again in October. Is that okay with you, Ruth? Did you want to add anything?
That sounds fine, Millie. Thank you.
Okay, thank you very much for that. That was a very helpful discussion. So I'd like to move on to the next item on the agenda, which is the Core 20+, and Ruth is going to take that forward for us. Ruth.
Thanks, Millie. And I've just realised, for the benefit of the live stream, it's probably a good idea if I introduce myself as well. So I'm Councillor Ruth Dombey. I'm leader of the London Borough of Sutton. I've been chairing the Health and Wellbeing Board here in Sutton since I became leader in 2012. And the 5 other borough leaders of the other boroughs have all asked me to be the local government representative leading on health for our sector. So we have all 6 Health and Wellbeing Board chairs on this partnership, but I'm also the lead for South West London, and as a result I'm the local government representative on the board, as well as co-chairing this partnership with Millie. And I was interested to hear in the initial comments being made by so many people the emphasis that we're quite rightly putting on health inequalities. I remember the days prior to 2010. I wouldn't say that neither the NHS or local government was awash with money, but certainly we didn't have the sort of financial constraints that we have today, and yet health inequalities worsened. And so I think, yes, it's about the funding. Yes, it's ensuring that the funding is in the right place. But I think we need to do a radical rethink about health inequalities and a deeper understanding about why they exist and what we can actually do in practice to tackle them. I don't need to explain to anyone on this partnership the importance of the work done by Professor Marmot and everyone else about the social determinants of health. But we all know that access to good healthcare, while it's absolutely vital, probably makes up only about 20% of the reasons for ill health, both mental health and physical health. And it's those other social determinants of health that are so very important, which is why this way of working in partnership, I think, is absolutely key. It allows us to address those very serious issues that we have, whether it's about poverty, housing, the environment, and the quality of the air that we breathe, as well as there's many other factors. So I'm delighted that the first substantive piece of work that we're doing as a partnership is around health inequalities. And I'm now going to introduce Gloria Rowland, who, Gloria, if you want to introduce yourself again and then take us through the excellent piece of work that you prepared. I'm absolutely pleased and delighted that we are starting off on this basis, because I think it's core to everything that we'll be doing. Gloria, I'll hand over to you.
Thank you very much, Councillor Dombey. And I just want to say good afternoon to you all. My name is Gloria Rowland, and I'm the Chief Nurse for the South West London ICS, and also co-SRO for health inequalities across the system. Today, I've got a presentation on Core 20+5, and I'm going to ask Govinda, can you put the slide up? I'm just going to assume that everybody have seen these slides. However, I'm just going to pick a few of the slides and probably talk about them just to bring this to life to all of us. And thanks for the introduction, Councillor Dombey, because again, health inequalities in itself has a lot to do with how we actually determine the health of our population. And if the Core 20+5 elements actually is just one piece. And I just want to say here in the beginning, I know a lot of work has gone on in South West London on how we are tackling health inequalities at both system and local levels. And I know the Health and Wellbeing Board, this is one of the things on the top of your agendas, and I know you've been working closely on this. In terms of local authority and my public health colleagues here, again, I know you've done a lot of work. So Call 20+5 was just one approach that we thought we can use to bring all of us together in the system. This approach was introduced by Public Health England about a year or so ago. And what they want us to do is to look at our 20% of our most deprived population and know where they are. And that's the 20, and I will explain that more later on. And our core, maybe one area that we think that we are struggling with. And our the 5 clinical areas nationally, which they've identified where they have evidence of health inequalities that is predominant across the whole system. But before I go into the Core 20+5 elements, I just want to give you a little bit of a background of what we've done so far within the system. After COVID, and after COVID had actually showed us that we have a lot of issues of health inequalities, which we are aware of, but I actually just shine the light into those issues further for us. What we did in Southwest London just after the second wave was to actually really take this seriously in terms of actually putting governance around how we tackle health inequalities across the system. So we now have a sort of like a board or a committee that actually are looking at health inequalities across the system. And we also have a delivery group, which comprises of both health and care. And I have to say, we've got about 3 directors of public health really helping in that, and people from local authorities, school, education. Is a system-wide approach where we are pulling things together. On the back of that is also working with places and also looking at some of the health and care plans that you all have in your local health and wellbeing board, and also looking at GSNA. So what we want to do when we started all this work is not to start from scratch, but to see what is already existing in the system and the work that is being going on in the system, and to recognize that and really acknowledge that, and look at how we can join all that up together as we tackle health inequalities within the system. Now, what we are also doing, there's a lot of regional objectives for this as we move into the new ICS and ICP. And also there are sort of like national policies that are out there now that we need to fulfill, plus really working with our communities and also anchor institutions across the system. And also, I just want to say the role of voluntary organization is really key as we move forward. Let's move to the next slide, please, Comida. Thank you. I'm not going to go through this as such. I think I've explained that previously. It's just to say that health inequality is absolutely important, that it's really happening at that place, shop floor level, with really working in collaboration with people that understands it, and also working with our community and voluntary care sector, which is really, really important. And very importantly are the people and the communities that we serve. And when we talk about health inequalities, we are talking about everything, including things that has to do with all the protective characteristics, and also thinking about intersectionalities. I know people have talked about social determinants of health. So it's not just looking at health, we are looking at housing, education, and so on and so forth. The approach we want to use is what they call the ABCD methodology, which is more or less an assets-based community development approach. And I will explain that later on, which is more about co-produce and co-delivery, co-production and co-delivery that is culturally sensitive and really focusing on that prevention aspect of the work. Let's move to the next slide, please. I'm not going to go through this because I think we will have to come back in terms of determining what are the key priorities for us. Just to say before the ICP is born, we just don't want to sit doing nothing while waiting for the ICP. So the Health Inequality Committee in the ICB has actually been working on this element of work. And again, whether these are the right thing to focus on now or later is something that hopefully this committee will be able to tell us, and we'll be able to agree on the key priorities for Southwest London. What we are clear about is that we want to pick 1, 2, 3 things that we can do together in Southwest London, and also what people can do at place level, which I think that is where the main focus are. I just want to make sure I mention that. But from the local ICB level point of view, these are the areas we are prioritizing and we are working on. Let's move to the next slide, please. So this is the core 20 plus 5, and this is what I was trying to explain. The core 20 is 20% of most of the pride population. The plus is one area that you feel that there are key issues that we've identified that is standing out among the issues that we've got in Southwest London. And the 5 are the 5 clinical areas which are here. And the first one is maternity, rightly so, is the beginning of life. Mental health in terms of ensuring annual mental health checks, which they put here at 60%. Chronic respiratory diseases, which covers COPD, all pulmonary diseases, COVID, flu, and so on. Early cancer diagnosis, again, they've given us a sort of like a target there. 75% of cases diagnosed as stage 1 and stage 2 by 2028. Finally, hypertension is one area that they want us to look at, and in terms of the risk of myocardial infarction and stroke. This is what the core 20 plus 5 means, but I'll now show you a slide that actually translate that to what it means to us in Southwest London. Let's move to the next slide, please. So this is one slide that actually just captured that for us nicely in Southwest London. From the population health management data intelligence that we did, it shows that 339 of our population lives in that 20% smooth deprived population in terms of those are our core 20. And if you look at it in terms of media, healthy life expectancy and life expectancy, I think it does show a bit of difference between both. I think the interesting bit is the third slide. It is the third line. This is when you can then think about it. If we know Southwest London, majority of our population are white, and if you then want to think about that, you think about it that most of the core 20 will be white, which is right. Most of the core 20 actually is the white community. But the beauty of population health management is if you then apply the principle of universal proportionalism to this, it then starts showing you where the health inequalities lie. So, which shows you what that third line is saying. If you pick 10 people that are Asian in the population of Southwest London, two of them will be living in your core 20 areas. If you then pick 10 Black, it shows you that 4.5, about half of them will actually be in your core 20 areas. If you pick people that are mixed, that identify themselves as mixed race, it will be 2 out of 10. And then our white population, which is the majority of the population, will be about 1.5. And if you then look at all this, you can see that already, if you want to think about this in terms of core 20 plus 5, your core will be Black community in this sense, if you are looking at race. If you then look at maybe things around sex or learning disability, that will actually show something completely different. So I just want to use that as an example of how you pick your core in terms of using that core 20 approach. In Southwest London, we know 50% of our core 20 lives in Croydon, and I know we know that from the COVID work we did, and that actually shows 40% of Croydon residents. Then in contrast to places like Richmond and Kingston, where we have about 2%. But I want to sound a word of caution here because, again, we have a well-documented evidence that where we have a lot of affluent people, we have pockets of deprivation, people that live there actually suffer greatly. So as much as we are looking at Croydon as a really big area where we have this demographic issue around core 20, we shouldn't forget those people that are actually in those affluent areas that are actually living in those poverty and deprivation. So we have to look after everybody. And finally, in terms of long-term condition, this is very interesting. You can look at the gap and say the gap is not that much, but actually that shows the symptoms of people not actually accessing the service or people not actually coming forward. So again, these are areas where we can actually do more work on. So I think I just want to give you this summary, and I'm just going to then just scroll through the slides. I know you've read this, and then I'll just really want to give room for questions. Let's move to the next slide quickly, and I won't really talk much about around the other slide. This map is really good because it tells you exactly where your core 20 is. It tells you the area, it gives you the figures of where they are. So again, each of the places have this graph. We've actually produced it for each area, so they know exactly what areas they are focusing their energy on. Let's move to the next slide, please. And this is just the 5 elements of the core 20. Again, the data is there, and I am happy to meet people out of here if you want me to actually explain more around this. Let's move to the next slide, please. And the next one, please. So This slide also is one beautiful slide that actually gives us a lot of data. If we then look at all the people that lives in your core 20+5 area, and we are now actually combining that with various things like long-term conditions. We know in Southwest London that we have 14 people that are very sick in terms of having four long-term conditions, plus the fact that on top of poverty, on top of deprivation and so on and so forth. The beauty of this is that we know where they are, we know the residents, we know their GP. So we are working with their GP to make sure that these people are getting the right care. And later on, we want to move to 3 long-term conditions. Again, what this has helped us to do is to focus on where we actually have the most need and where we can actually start those work that we really want to do. Let's move to the next slide, please. And I'm not going to talk about it. This is just methodology. And thank you, Carol, for mentioning QI, because again, as we do this work, it's not just about it. When I say there's a lot of projects around health inequalities, yes, there are. But I think where I struggle with, if you then say, what are the impact and what impact is it making? How are we evaluating the impact? The impact? I think that's where we struggle with. I think putting it sort of like once we start putting intervention in, what is really important is actually measuring impact. And the way we can do that is using that QI methodology, continuous improvement methodology, to make sure that those impacts are really making difference in people's life. Let's move to the next slide, please. I know you will then be asking me, you've given us this data, and so what? So we've been doing a lot of work within the system, like I said, using JSNA, using the health and care plan. And it's about how do we then start interpreting some of the figures, the data I've showed you, into action. We did apply for a bid for looking at developing connectors that will go into the communities, help develop intervention, and then co-producing and co-working with our community sector, voluntary sector, to actually look at putting intervention in and also mentioning those intervention. And I just want to say to you now, that majority of all the places have actually identified the areas they want to work on. And these are a few examples, which I'm not going to go into deeply, but each area have identified areas they are working on, and we're going to measure the impact in terms of this. And you can see our emphasis is about outcome, and you can see every single slide we have impact and what we are aiming to measure. Let's move to the next slide, please. Again, this is further home. This is another one. This is Kingston. Let's move to the next slide, please. Again, you can see this is another, and this is another community. And again, Kingston, looking at a different population that is actually predominant in that area. Let's move to the next slide, please. And that's Croydon. Again, a lot of work is going down in Croydon, and again, you can see where the areas of focus in terms of looking at those health inequalities around that area. Let's move to the next slide, please. And this is just to give you an example of how we got the Connectors program and the funding. And I'm not going to bore you with this because, again, this is something that we are working through behind the scene. Let's move to the next slide, please. This is a summary of the work that is going on, and I want you to see this slide because, again, like I said, as much as we are doing work, we can do work at Southwest London level. Where we really need to see that impact is at that place level, at that local level, working with our voluntary healthcare system and the whole system. And you can see Croydon, their target is to look at hypertension and diabetics, and they are targeting Black and ethnic minority group. Kingston is looking at, you can see the areas, and these areas are in the core 20. Again, this is how we've translated and used those data. And they are looking at type 2 diabetes and CVD, and you can see the communities that they are working with. Sutton is looking at homelessness and rough sleepers, and which in terms of support for drugs and alcohol. And Wandsworth, they are looking at diabetics, targeting South Asian community. Martin is looking at hypertension in Black and ethnic minority group. And Richmond, they are planning to look at diabetics in Richmond. Again, this just gives you a flavor of what is going on at the back of the data I showed to you. Let's move to the next slide, please. And this is just to show you the challenges we have. And thank you for the person that mentioned resources. Is really key. It's really important. Another areas is data. Data is a national problem. And I know Millie is really looking at this from the Health Inequality Committee point of view. How do we solve like on block issue around ethnicity coding and other protective characteristics that we really need data for? Long-term condition is massive. And again, you can see some of the things are presented in terms of long-term condition. And it's more or less looking at that commitment and pace. And I know people have spoken about pace again. Again, this is really aligned in terms of some of the thinking around the work we need to do here. Let's move to the next slide, please. I'm almost done. And these are just the next step. We are really making, like I said, we don't want to work in isolation. We don't want it disjointed. We are doing some mapping exercise across the GSNA and health and care plan. And this week we met with all the GSNA leads across the system. And I know some of them are on this call. Again, we are working closely to actually see how we can influence. And when they are writing the next GSNA, to make sure that we all contribute to that, and we look at how we prioritize areas we need to focus on. There are areas around metrics and so on and so forth. Again, around long-term condition, we are waiting list, and then how do we work with those communities? And I'll just leave it here, and I'll take questions. Thank you. Thank you, Govinda. So back over to you.
So shall I pick up on the question? I'll pick up on the questions, Millie. I can hear some feedback, but I'll keep going. So I've got Catherine, Anna, and Sugrinder want to come in. Catherine?
Thank you very much. Thank you, Gloria, for the presentation, and thank you for mentioning how key the voluntary sector is in this. And it's good to hear about the positive stories that there are from the project. I think talking to my voluntary sector colleagues, the process hasn't been completely smooth, and I think there is potentially some learning from this project in terms of how things are set up initially and having early engagement. I appreciate the time this happened. It was a very stressful, busy time for everyone, but all the partners have said that potentially if we have to find a way, and thinking of where we are today and trying to work together more, of being able to have earlier engagement to design programmes, because there is feedback that potentially, although good things are happening, even more could have been done if there'd been engagement with the voluntary sector. And indeed, they've mentioned other partners, public health, etc. So it's really, I think, just because of where we are today, I just want to make that point that I think it would be helpful if when we have these opportunities, there can be that earlier engagement to ensure we can learn more. And I think that a review of some of the work that's gone on in terms of that process would be helpful in the context of working together in partnership further. And they all certainly would support your point about resources are very limited, and really it is quite difficult delivering with the budget that is available. But thank you.
Thanks, Catherine. And Laura, if it's all right with you, there's 4 or 5 people who want to come in. So in the interest of time, we'll take them all and then come back to you, if that's okay. But I think that's a really important point, Catherine. And looking at the level of insight that there is into our local communities, it's really important that we involve the voluntary and community sector at a very early stage, so that we can ensure that the programmes and the things that we're suggesting are actually relevant for our local communities. Thank you for that. Anna, do you want to come in?
Thank you, Councillor. Thank you, Gloria, for an exciting presentation. I think the ambition for South West London to tackle inequalities is even more tangible, having heard you speak today. So many thanks. Of course, you wouldn't be me as the Director of Children's Services if I would stay silent at this point. And this is more of a plea and an ask, you know, to you and to the board mainly. I really want us to stay laser sharp focused on children and young people, because if we are really honest and in our attempt and ambition to tackle health inequalities, I think we need to start early on. So I would welcome, you know, to see something similar for children's. I think that will be great, and with again that focus on Black and minoritized communities, because we know those are, you know, the ones that need us most, you know, in terms of promoting outcomes. So a plea, don't forget children in this conversation. Thank you.
Thanks, Anna. And we all know the importance of the first 1,000 days, as well as the whole perinatal issues around mental health with families as well. And you'll be interested to know that as the 6 Health and Wellbeing Board chairs are all talking to each other and to their own local boroughs about whether within the Health and Wellbeing Board we're actually doing enough from the point of view of children. We do a lot around adults, and I think we need to ensure that there's a focus also on children and young people, and actually babies, children and young people. I'll add in that as well. And it's Sugrinder comes in next.
Thank you, Chair. And Gloria, thank you. That was quite comprehensive, so really appreciate that. Gloria, I was reflecting, I suppose, time when I led the Runnymede Trust, but also when I led inclusion and uptake work at the Cadbury Trust. And I suppose one of the things that I'm very aware of is how much detail can be hidden and sometimes lost in the other category. So, and I think your data showed 12% of other. I suppose my comment is about making sure that we're able to demonstrate good understanding of the minority groups that are in that category and their specific needs, so that when you're setting priorities, that we're not just assessing the needs of the majority minorities, but also the minority minorities, if you like. And I noted, for example, that the Kingston slide that you showed, which flagged up the Korean community, they also talk about Tamils, but the Tamil experience isn't reflected in your overall priorities, and there may be a very good reason for that. So I suppose it's just making sure that at this high level that we've got the right assurance of the granular knowledge of all of the minority groups and how or why they are then reflected in the plans and the priorities.
Thanks. I think that's a really important point. I'm going to bring in Shannon and Liz and then come back to you, Gloria. And I'm conscious we're running over slightly. Sorry, Millie, you're a better chair than me. So I'll take Shannon and Liz and then hand back to Gloria. Thank you.
Thank you. So I just have a couple of comments, and I think my first comment on the presentation, I think it's great that we, understand our deprived populations and we're able to profile those people who have long-term conditions. I think the challenge for us as an integrated care partnership is how we now shift towards identifying those people who we don't yet know about because they haven't necessarily presented to some of our services, and then putting measures in place to prevent those people from developing disease in the first place by managing the risk factors, because I think that's where we will stand to make the most significant gains at a population level. And my second question is really more about how do we embed health inequalities in some of the work that we do anyway, as opposed to some of the new priority areas that we might want to identify. Because I think, we've got these really good examples of how, the community connectors are working at an individual level, but we also need to think at the other different levels, at the community level, and also in terms of civic interventions that cover the whole population. So not only should we be working at the individual level, but we should be thinking about our policies, our strategies, the delivery of our commission services, and how we put the inequality lens into those processes so that we can think about how we support the whole population to stay healthy. Thank you.
Thanks, Shannon. And Gloria, I'd just add to Shannon's first point, there, as our communities become more diverse, which we all welcome, there are many parts of the world where it's not normal procedure to register with a GP. So I lived in a European country where you don't do that. So it could well be that actually, while our data, I'm sure, is relevant and important, there could well be communities that come to this country, come to our communities, and don't appreciate the importance of registering for a GP as one of the most important things you need to do. So we need to do some work, I think, in our boroughs to ensure that everyone in those communities understands the importance of doing that. Liz.
Thanks. The first couple of points I wanted to make were about the data, and the first one is that it's reassuring to see that several of the directors of public health are involved with the work, because I think when it started off about November or December last year, I think the data set that was being used by South West London differed rather from the data set that was being used by the directors of public health, because I think the derivations are different, and therefore bringing together those two data sets and understanding what it is, how they're generated and what it is they're saying feels important. I think also thinking about the granularity of the data, it's keeping an awareness of really where there are health inequalities, what the trends are on those health inequalities, because I think, Ruth, you started off by saying that about 12 years ago the inequalities had widened. Some of that, from what I remember, was because all cohorts of people, their health had improved, but it had improved far greater in the more advantaged communities, I think particularly around cardiac health. So I think when we're talking about relative changes, it's also important to look at the trends in the individual cohorts. And I guess my last point is one, I guess, for a continual reflection on, which is the huge breadth of the agenda, both for this particular area of work and also for the ICP as a whole. And just to take one example of housing, which of course Marmot has said is a very important determinant of health, but just reflecting on the challenges of how that might be brought into the deliberations of this particular body. And I guess that's probably not a question to answer today, but an important question to be thinking about in the immediate future. Thanks.
Thanks, Liz. And Gloria, a lot of what's been said I know we'd all agree with, and it's important for the work as we go forward. Really helpful comments. Do you want to pick up a couple of the questions and address them?
Yes, I'm just probably going to summarize and just say thank you to everybody for your comments, and we will make sure that all those comments are going to be used in terms of how we develop the work going forward. But I just want to pick one or two things in terms of the children and young people. This is really important to our heart. We've set up Children and Young People's Board in Southwest London for the first time, and Anna is actually co-chaired our board. So rightly so, Anna. And just to assure you that we are looking at Core 20+5 for children as well, and that work is actually ongoing as we speak. And just to say, in terms of other minority group, definitely, I totally agree with you. We are going to look at that. And when we say other, sometimes even the data doesn't really show really what that others mean. And I agree with you that we really need to do a deep dive into what is that telling us. And in terms of risk factor, definitely totally agree in terms of people we don't know, the people that have not registered with the GP, people that have not come forward, and it's about how do we tackle that and how we bring that to into light. In terms of how we change the culture in the system whereby health inequalities is embedded into everything we do, I think that is key. Health inequality is not one thing there. It's actually what everybody needs to breathe and live. And one of the 8 things we are looking at is in terms of looking at our EQIA, how we do health inequality impact assessments. How many documents have I seen where they will say there's no impact? There are no impacts. Again, we want to do a piece of work across the system on how we can actually use that to actually start changing culture and probably changing mindset. I'm going to stop there. Other questions I'll pick out of the room, and if you want to email me directly, I will ask our individual questions. Thank you.
Gloria, thank you. It was really excellent and sets a good foundation for the work we need to do going forward. Millie, back to you.
Can I just check with the administrators? We're not going to be cut off right now, are we? No? Okay. I'll carry on then just for a few minutes because we've come to the end of the formal business for today's meeting, but there's a very important piece of work left yet, which is taking questions. So I've got one question that I'm aware of, which has come on the email. So I'll read it out, slightly paraphrasing, if you would excuse me. The question is from Elspeth Clark, and she is keen to understand that how this structure is going to avoid duplication of committees and focus groups and projects, etc. And she feels that previously there's been much duplication, and she's raised it and it's continued. The second part of the question is about digital technology. And she says it's all very well for those that are able to use digital technology, but what about people who don't? So I'm going to look at Andrew Dimitriadis, I think, to answer the question for us, and then I'm going to take questions from the public. Andrew.
Yeah, Millie, I think Sarah's happy just to give just a brief view, I think, on the first bit, and then I think Karen's going to do just a really short sort of summary response, if that's all right.
Sarah, can you help me out here?
I'll go because we've only got 1 minute left. Let me give it a
Yeah.
go. So obviously, as a system, we will try and ensure that any committees or groups that we set up are focused on delivery. I think that's going to be really key. As an ICS, I think that's what we want to do. We want to identify the key priorities for us together, and then we want to really focus on a delivery focus. So we need to make sure, I think, that we are checking those things together. I think we want to make sure that we haven't got duplication, and I think integration is about us working together, not about us doing things multiple times. So I think we'll just have to check ourselves as we go forwards and make sure that's happening. On digital, I will quickly just say that definitely from an NHS perspective, and I know with local authorities, I don't think we want to exclude anyone that doesn't use digital technology. We want to make sure that people still have availability to access services without digital technology. But let's not forget that this is a really important piece of work for us to look at how we, for those that want to and can access services digitally. So we need to do both, would be my view, and we will make sure that we continue to deliver services face to face and in other ways through telephones and things like that. But I think we shouldn't forget the digital revolution, and we should make sure that we make the most of that as a system.
Thank you very much, Sarah. Are there any questions from the public very quickly? Okay, I don't see any.
Millie, can I just mention one thing, if I may? Can you hear me all right?
Yes.
So we have had, I think, as Ben put in the chat, some difficulties, I think, with the live recording and the sound, I think, and there may well have been, just to be, I think, clear, there may well have been questions that we've had. We will pick those up outside. We'll obviously publish the live broadcast, and if there are specific additional questions, we'll respond to those so that people have a response. But just wanted to mention that.
Thank you very much. I have been looking at the chat and there are, so thank you very much. Please do submit your questions if we've missed them, and we will answer them. And lastly, there are other comments in the chat, so I'm sure people will pick them up, presenters, particularly around Core 20. So thank you very much for that. That was a very energetic first meeting. And I know Ruth and I are both smiling, thinking that's really gone well, because it was important to set off on the right foot, and we wanted to set off with some real business. So you've had some real business, and thank you very much for participating in it. So the next bit is we smartly log out of this one and log into your next item in your diary to join the workshop. And we will let you know how that workshop's going to run in terms of time off and so on once you've joined. So thank you very much again. Please join on the other link. Thank you. Bye-bye.